Today at the National Press Club, the Honourable Mark Butler, Minister for Health and Ageing, as well as Disability and the NDIS. He'll detail the priorities and challenges he sees across the two portfolios for Labor's second term of government. Mark Butler with today's National Press Club address.
Hello and welcome to the National Press Club and today's Westpac address. My name's Tom Connell. I am the club's president and anchor at Sky News Australia. Today's guest is Mark Butler. He's the Minister for Disability, for the National Disability Insurance Scheme, for Health and for Ageing. In other words, it's hard for him to fit in a Port Adelaide game. Perhaps not a bad thing this year, I might suggest. His speech today will focus on securing the future of the NDIS, which is both something the Labor government of today and yesteryear are proud of and increasingly acknowledging does have a sustainability issue. I should note before coming to air, we announced the winners of the Excellence in Health Journalism Awards. Natasha Robertson, the health editor for The Australian, the 2025 Health Journalist of the Year, so congratulations to Natasha. And now continue your applause as we join with me and welcome Minister Mark Butler to the podium.
Well, thank you, Tom. Thank you, everyone. Can I acknowledge at the outset, of course, that we come together on the lands of the Ngunnawal and Ngambri people and pay my respects to their elders, past, present and emerging. I also want to acknowledge all of those in the audience, both here at the Press Club and at home, who enjoy the support of the NDIS. As the Minister for Disability and for the scheme, it's my duty to ensure that you receive the support and the care that you need to create a life of equality and independence. It's a duty that I take seriously and I intend to fulfil. I'm also grateful for some of my parliamentary colleagues joining me here today, in particular the NDIS Minister herself, Senator McAllister. A long time ago, the first several years of my adult working life in Adelaide in the early to mid-1990s were spent working across what we now call the care economy. On an almost daily basis, I'd visit childcare centres, aged care homes and hospitals, as well as the big disability and psychiatric institutions which were still open in those days. These were some of the most instructive and rewarding years I've ever had at work, talking with staff, managers and operators, and where possible, consumers, patients and clients, and observing systems that at the time were in very deep flux. Still, big homes at Strathmont and Minda housed literally hundreds and hundreds of South Australians with disability, usually for their entire lives, as did the Julia Farr Centre, which had until recently been called the home for the incurables. Today, I now have the privilege of talking, for example, with a young adult with a profound disability who is supported by the NDIS and comparing their position to the residents that I met 30 years ago or more. And the difference is beyond profound. The NDIS, of course, didn't drop out of the sky. It was the product of determined advocacy by disability advocates stretching back decades. The disability rights movement of the 1970s and 80s, the push for deinstitutionalisation, the campaign, of course, for an insurance scheme founded on choice and control, the campaign led by Bruce Bonahady, Rhonda Galbally, John Della Bosca, the National Disability and Carer Alliance, the National People with Disabilities and Carer Council, and friends, activists and advocates in communities right across the country who came together under the banner Every Australian Counts. And importantly, a government led by Kevin Rudd and Julia Gillard who had the vision and determination to make it happen, delivered, of course, by Ministers Jenny Macklin and Bill Shorten. Within just 12 years, Australia's NDIS has gone from a dream of generations of activists to an entrenched and beloved national institution. It really is a symbol of what our democracy can achieve when we lay down our weapons and actually talk to each other, proof that democracy still works. But the job isn't done. The scheme is now entering its adolescence, a period that all parents know involves the maturing of our beautiful children, but a period also which can be full of risks that things will run off the rails without a judicious dose of management and supervision. The NDIS has grown incredibly fast and well beyond projections. It's created new markets which have in turn impacted and sometimes distorted other parts of the health and social care ecosystem. These reasons and others led to the establishment of the NDIS review back in 2022 that was led by Bruce Bonner-Haedy and Lisa Paul, and their recommendations remain a crucial guide for our government. But that review was only the beginning of the hard work that still has a long way to go. And today I want to focus on two ongoing substantial challenges. First, returning the scheme to its original purpose, its North Star if you like, the provision of support to people with significant and permanent disability. And secondly, ensuring that the scheme does become sustainable from a budget perspective. I hope it goes without saying that meeting those challenges and others will always be framed with the interests and the choices of those living with a disability right at the centre of our thinking, staying true to the promise of nothing about us without us. Originally intended to support around 410,000 people with disability, the scheme now supports just under 740,000 and is projected to grow to 1 million by 2034. When we came to government in 2022, the scheme's costs were growing at an extraordinary 22% per year. To put that into some perspective, aged care is projected to grow by around 5% per year, notwithstanding the huge increase in demand that is projected, of course, by the ageing of the baby boomer generation. Medicare is expected also to grow by around 5% per year. National Cabinet back in 2023 agreed to get growth in the NDIS down to 8% by next year. But even under that scenario, the NDIS is still forecast to cost $105 billion and will increase its share of the economy, or GDP, by fully 0.5% over the coming decade. That's the equivalent of growth in Medicare, defence and aged care combined, measured as a share of GDP. Getting growth down from 22% to 8% will certainly be a substantial achievement. And while there are promising signs, everything that the government and the agency have put in place over the past couple of years needs to go right to avoid us slipping off that target. Reforms to plan budgets and inflation are starting to work, but growth in new participant numbers remains high. Last week's quarterly report from the agency revealed 12% growth in participant numbers in 2024-25, much higher than the previous year, reminding us that there is still much to do, even to achieve that 8% target. But 8% growth is simply unsustainable in the medium to long term. National Cabinet agreed in 2023 that 8% growth was an interim target only, and that growth would have to moderate further in time. After we achieve our current target set for next year, a further wave of reform will be needed to get growth down further to a more sustainable position, and I'm determined to pursue that next wave of reform. There's no significant change in disability prevalence in the community, and the scheme is now pretty much fully rolled out. So growth should really reflect unit price inflation plus growth in Australia's population. In nominal terms, that would hover around 4 or 5%. On top of that, we should allow an inflator that reflects the ageing of participants in the scheme, which might add up to another 1%, taking us to around 5 or 6%. I do note, though, that the Productivity Commission's 2017 report suggested a growth rate of around 4% would be appropriate after the scheme was fully rolled out in 2020. Now, we must always remember the NDIS is quite unique as a social program. Unlike Medicare and aged care, which touch most Australians, the NDIS supports only around 1 in 40 Australians directly. Bringing growth under control is therefore not just a question of budget sustainability. Social licence is also particularly important to such a scheme. And right now, although that licence is still strong, I do worry that it's coming under pressure. Recent research by Talbot Mills found that 7 in 10 Australians do agree the NDIS plays a vital role in improving the lives of disability. But 7 in 10 also agreed the NDIS has grown too large and is struggling with inefficiencies and dodgy providers. Fully 6 in 10 Australians agreed the NDIS is broken. Now, while it eventually attracted bipartisan support, the NDIS, it must be remembered, was a Labor creation. And as a Labor minister, I am utterly determined to do whatever I need to do to secure the scheme's future. The future reform agenda to bring growth down further will continue to draw heavily on the ideas that are canvassed in the NDIS review by Bonner, Haiti and Paul, which was focused on putting people with disability and their families back at the centre of the scheme, on building public trust and confidence, and ensuring that the scheme was sustainable. There is, for example, real potential to introduce more pricing discipline into the scheme, drawing on the independent pricing experience in hospitals and in aged care. As much as possible, the pricing of services across health and those two big care sectors should be aligned to maximise efficiency and to prevent distortion, but also to get the best value of money from the scheme participants and for taxpayers. The work on fraud and integrity must also continue. In a recent report, the National Audit Office concluded that prior to 2024, the NDIS lacked basic prevention controls for fraud and non-compliance. I think Australians are rightly appalled by the drumbeat of stories about shonks and fraudsters who are ripping off taxpayers and, more importantly, people with a disability, and I, for one, share their disgust. Our government has taken fraud seriously, investing more than $500 million to build the capacity of the agency to identify high-risk claims and prevent fraud against the scheme. In just 2 years, we've launched more than 600 investigations and executed 65 search warrants on individuals who are suspected of ripping off millions of dollars from people with disability and taxpayers. While our efforts are bearing fruit, more does need to be done to protect the NDIS and the people who rely upon it. And that work is going to require a much more robust system of market stewardship, including a well-calibrated system of provider registration. While there are currently more than 260,000 NDIS service providers, only 16,000 are registered. I'll repeat that. 15 out of 16 NDIS service providers are unregistered, leaving far too much scope for poor quality service, sharp practice, conflicts of interest, and precious little oversight. That simply has to change. There should also, I think, be a more rigorous evidence base for the supports that are being funded through the scheme by taxpayers. Taxpayers deserve to know that the big investment we make in the NDIS is paying for supports that are actually going to make a difference. That next wave of reform will, of course, involve the deepest collaboration with the disability community and participants. Alongside various mechanisms that already exist to drive that collaboration, the government recently announced the establishment of the NDIS Reform Advisory Committee. That group, which will work directly with Minister McAllister, will bring together the diverse voice of people with disability to advise on ongoing reforms to the NDIS, including our response to the review and to the Disability Royal Commission. Again, as people with disability rightly demand, nothing about us without us. The second challenge I mentioned earlier goes to an unintended aspect of the scheme's rollout, and that is the enrolment of large numbers of young children with mild to moderate developmental delay or autism. Remember, the NDIS was established to support people with significant and permanent disability. Since the scheme's creation, the number of people with disability entering the scheme has generally stabilised close to initial projections, except in one area: children with developmental delay or autism. Just under half of the scheme's participants are now children under 15, a share that rose again in this month's latest quarterly report. And fully half of new NDIS entrants are under the age of 9, most of whom have developmental delay or autism and are entering the scheme under the early intervention stream. Now, I think most Australians would be alarmed to know that now 1 out of every 10 6-year-olds are on the NDIS, including 16% of 6-year-old boys. That's 1 in every 6 boys in the average grade 2 classroom. In some regions, it's even higher. In the mid-north of New South Wales, it's 1 in 4 6-year-old boys. In the Hunter region, it's 1 in 5. The Hunter, which was one of the NDIS pilot sites, of course, has one of the most bedded down NDIS systems, and trends suggest that what is happening there is likely to happen elsewhere unless a better way is found. Tens and tens of thousands of young children with mild to moderate developmental delay or autism are on a scheme set up for permanent disability. I doubt very much that that is what most of their parents really wanted or expected, but it's all they've had available. The only port in the storm, if you like. And it's not their fault. They love their children. They want the best for them. They're desperate, absolutely desperate, I know, to get their children diagnosed because we've made it the only way they can get help. And too often they have to wait for ages and pay thousands of dollars just to get that diagnosis. Families who are looking for additional supports in mainstream services can't find them because they largely don't exist anymore. And in that, all governments have failed them. The NDIS model just doesn't suit their needs. Individualised plans and budgets make sense for people with lifelong disability. It gives them more choice and control about the support that they receive. But families with a young child who's missing some milestones are not best helped by receiving a budget of $10,000 or $20,000 or $30,000 and then being expected to work out themselves how to spend it. And frankly, many of those children are being overserviced. The extent of therapy provided to those children now in the NDIS is extremely high compared to anything that you would see in the health system. On average, just an average, a young NDIS participant with moderate needs is receiving more than 70 therapy sessions in a year. Now, there is no evidence that I'm aware of that supports children being taken away from learning and other activities for that much therapy. And the scheme doesn't require any such evidence, unlike Medicare, for example, that would subject such a regimen to rigorous assessment before funding it. Parents need to be supported much better because we know that children have the best chance to thrive when the families feel well supported. Parents and families need guidance to access well-curated, evidence-based support and therapy, most of which did exist long before the NDIS. Only around 1 in 50 people have significant and permanent disability, hence the need for a unique, bespoke scheme like the NDIS. But 10 in 50 young children will experience developmental delay or autism, mostly at mild to moderate levels. That's a broad-based, mainstream issue that demands broad-based and mainstream services. Now, I know this will be hard for some parents to hear, and I don't say it lightly, but we do need, as a matter of urgency, to create a better system that will enable our children to thrive. They are precious. We all love them. They're our future. Children with mild to moderate developmental delay or autism need a robust system of supports to help them thrive, a program for thriving kids. And that's the program that I intend to deliver. Bonner, Haidee and Paul urged governments to rebuild that type of support, something they called foundational supports for this group of kids. National Cabinet accepted that recommendation and agreed to share funding for it equally between the states and the Commonwealth. But this work has drifted. Diverting this group of kids over time from the NDIS is an important element of making the scheme sustainable and returning it to its original intent, servicing people with permanent significant disability. Access and eligibility changes will be made to do that once the Thriving Kids program is fully rolled out. Children who are enrolled in the NDIS now or who become enrolled before that time will remain on the scheme subject to its usual arrangements, including from time to time reassessments. But more important than sustainability, standing up a robust program for thriving kids is what these children and their parents need, sooner rather than later. They need the Commonwealth and the states to work together and to commit on an ongoing basis to funding it together. And I make that commitment on behalf of the Commonwealth today. We've made a $2 billion provision in the budget for the Commonwealth's share of thriving kids. The Commonwealth is also willing, indeed we're keen, to step up and lead the work in designing that program because it should be a nationally consistent program. We don't need a blank piece of paper and a pen. The systems already exist to be leveraged, to be focused. We need to look obviously for the gaps and focus on how to fill them. But everything we do must aim to identify needs as early as possible in a child's life and get them and their parents the intervention that will work best for them. Infant or child and maternal health systems provided by states are usually the first opportunity to make those checks. Inklings, as one example, is a program developed by the Kids Institute in Perth that taps into that early connection to support children from their first months of life who are showing difference in how they communicate and relate to others, particularly to their parents. Backed by over 10 years of clinical trial research, Inklings is a 10-session program that uses short videos of a parent interacting with their baby to help them better understand the different ways that their baby communicates their thoughts, their feelings and their needs. Inklings has already rolled out through WA's child health system and is now moving to South Australia. During the toddler years, families will more interact with their local GPs, early learning centres and other community health supports. Again, systems that already support children and families with those needs and are ripe for a greater focus. We'll examine the creation of a new Medicare item for bulk billed 3-year-old health checks to pick up any developmental concerns at that crucial age for referral for appropriate support. Improved decision-making tools for health professionals and better workforce training on child development will help create a stronger system of supports for kids and for their parents. Similar schemes, of course, were implemented when Labor was last in government, but were then scrapped by Tony Abbott. The College of GPs has been calling for some years now for a child development check like this to be re-established because they know it worked. Where these checks find that kids need additional supports, we'll also look at providing access to new Medicare allied health items. Things like occupational therapy to strengthen play skills, fine and gross motor skills, concentration and self-regulation. Speech pathology to support speech, language, literacy, as well as the use of signs, symbols and gestures to support kids to communicate and build relationships. And psychosocial therapy to support developing essential social skills, emotional regulation and executive function. Some jurisdictions we know also still have community centres that parents are able to drop into for that type of support, like Tasmania's Child and Family Learning Centres, which provide a range of wraparound supports for kids and families, or Canberra's Child and Family Centres here, which provide a single place for families to get their children assessments, support and referrals for the right care that they need. And we're going to work with states to scale up those efforts. Early childhood education and care is also a crucial touch point for families, and that will become even more important as we move towards more universal provision, including through the abolition of the activity test. ECEC workers, I think, see more children under 5 than anyone else in our community. They can pick up when something needs attention. And centres are also highly convenient places for families to access supports. Our $1 billion Building Early Education Fund is a great opportunity to work together with state and local government, with philanthropic organisations and communities to bring a whole range of related and important services for very young children under the same roof. And I know that schools can play a more coordinated role, very different to the individualised approach right now that sees school principals reporting literally dozens and dozens of different therapists turning up to their school to provide therapy to individual students one at a time. Mental health in primary schools, or MIPS as it's known, is just one example of a more broad-based approach to supporting young children with a range of needs at that age, including autism or ADHD. Developed by the Murdoch Children's Research Institute, this program has been delivered already across Victorian primary schools and is now being piloted in Queensland and South Australia. Positive Partnerships is a program that supports teachers, principals and other school staff to build their understanding and their expertise in working with autistic children. It includes workshops and information sessions for parents and carers as well of autistic school-aged children, and a dedicated website with online learning modules and other resources. This program complements the work that states I know are doing to build school-based supports for students with developmental delay and autism, but more can be done to leverage this area. And we must always remember, always bear in mind that parents are better placed than anyone to support their own kids. Parents obviously want to do everything possible to help their kids thrive, but they do need consistent information that they can trust to fully understand how to help their children, actively building skill development into daily routines, developing better parenting skills, and navigating that wide range of supports that is available to them out there in the community. And at present, this just isn't as easy as it should be. We're going to look at creating a nationally consistent online information service, something like 1800 Medicare or the Carers Gateway that already exist, that will provide parents with free supports and guidance on where to seek help if they're worried about their child's development. Excellent examples we know already exist, like the Early Years app in SA, the Raising Children network, trusted sources of science-based information about child health, learning, development and wellbeing. Or the Autism What Next website, run by Autism Awareness Australia and Amaze Autism Connect. This comprehensive website contains articles, infographics and videos with resources and advice for parents, from parents themselves, from carers, professionals, advocates and importantly Australians living with autism. All evidence-based and completely free to access anywhere, anytime. We know that wonderful networks already exist in the Australian community, and with the right resourcing, we can put them to much more effective use to help our kids thrive. Supported playgroups are already funded by our government, helping parents to build confidence to meet their child's needs right from birth up to school age. In community services, early learning centres and schools across Australia, trained practitioners are facilitating play-based activities to support a child's healthy development. All of these programs are ripe for more focus, more breadth to meet the needs of Australia's parents and their beautiful kids. But parents will rightly want to know what thriving kids will look like before they steer away from the NDIS, which has been, as I said, the only port in the storm for many years, which is why I'm determined to start that work right now. Over coming months, we will work with the community to design a system to support thriving kids and how best to invest the Commonwealth's $2 billion provision. States are obviously going to be key partners, having committed to share funding equally, but also because they hold so many of these levers. But so will service providers and, importantly, parents themselves. I intend to work with those groups directly over the coming months to design Thriving Kids in more detail. And I'm delighted that Australia's preeminent paediatrician and childhood development expert, Frank Oberclade AM, has agreed to co-chair that work with me. I want Thriving Kids to start rolling out from the 1st of July next year. The ramp-up of services and supports will be completed over the following 12 months, when access changes to the NDIS will take effect in mid-2027. It really was an enormous privilege to be asked by the Prime Minister to take responsibility for health, disability and ageing after the last election. This unified portfolio approach allows us, I think, to get the most out of our terrific health and social care workforce, while also ensuring that our large taxpayer investment delivers the most effective benefit to patients, to consumers and to participants. But I'm also deeply conscious that it gathers together responsibility for some of Australia's most important and certainly most deeply loved social programs: Medicare, the PBS and now the NDIS. Programs that every day make Australian lives better, healthier and more fulfilling. But none of these programs can operate on a set and forget basis. They all require constant vigilance to ensure that they are delivering for Australians who need them, but also represent value for money for taxpayers who fund them. And that approach will be the approach that will guide how we secure the future of Australia's NDIS. Thank you very much.
Thank you, Minister. So you've really approached head on there, I guess, the biggest sustainability issue or budget increase that a lot of experts talk about. People on the scheme with ADHD or autism. You spoke around a low or mid-level in terms of where they're best suited, not with the NDIS. A lot of experts speak about getting away from diagnosis and addressing it in terms of functional impairment. Well, what will you rely on? Is it just diagnosis? Is it functional impairment? Is it a combination?
Well, the scheme more broadly is moving more to the question of functional impairment. That is the way assessments will work into the future. And there's no question that there will be significant numbers of people with autism still on the scheme because they have a level of autism that is permanently and significantly disabling. And that is as it should be. The concern I've raised, and I think is the subject of substantial conversation in the community, is the degree to which young children with more mild and moderate levels of developmental delay or autism are on a scheme, frankly, because there's nothing else. A scheme set up for permanent, significant disability, and that unintended consequence of the establishment of the NDIS is what I've said today we intend to deal with. But I come back to the point, the whole reason for both of those two challenges I've talked about is to secure the future of this scheme. We should celebrate this scheme as probably the most significant example of social progress in the last 30 years. It has transformed the lives of people living with permanent significant disability, and I feel very deeply the responsibility to do everything I can to secure its future for the long term.
And just to clarify, you spoke about people, if they qualify for the scheme, they'll stay on it as a default. But for people for whom Thriving Kids is a better fit, why not? Will there be a measure to push them, force them, suggest to them that they go into Thriving Kids? How will that work?
Well, parents ultimately make up their minds when there are alternative systems. I'm absolutely convinced that a mainstream, broad-based system of supports for Thriving Kids, to support Thriving Kids, is the best choice for Australia's children and their parents with the level of developmental delay and autism I'm talking about. Over that sort of transition period, while we're building that system, parents will make a choice if there are two options available to them. But from the 1st of July 2027, there will be access and eligibility changes put in place that do steer those parents and their children towards the system of Thriving Kids, and that I think will be entirely appropriate.
First question from the floor, Natasha Chrysanthus from the SMH and the Age.
Thank you, Minister, for your address. Since I suppose so much of the discussion here about the NDIS is comparing initial forecasts to where we've ended up a dozen years later, with this new system, do you have an idea of how many children you anticipate will be using it either at the beginning or when it's actualised? And similarly, how much that system would cost? You mentioned a $2 billion starting Commonwealth contribution shared by the states. So what is a reasonable Commonwealth contribution over the long term to this system, given that the Commonwealth will continue to fund the NDIS? And just additionally, if you wouldn't mind, you mentioned obviously the significantly larger take-up among children in regional parts of New South Wales, like the Hunter. That's mirrored in Victoria, South Australia and Queensland. To what extent is workforce and resourcing going to be a challenge when it comes to rolling this system out to address that level of need across the country equally?
Thanks for those several questions.
You're welcome.
First of all, I made it clear that quite a bit of design work needs to happen between states and the Commonwealth in partnership with the sector and with parents themselves. We've obviously, through the agency, been doing work to model the numbers of children with more mild to moderate levels of developmental delay and autism. States are keen to understand that as much as we are, because we do have to work out financing, scheme design and things like that, and that work is still underway. So, precise numbers, precise design of the program is something that I've indicated we do need to start work on with states, because this work has drifted. But I also want to reinforce my sense of the urgency of this. Children with mild to moderate levels of developmental delay and autism should not, in my view, be on a scheme set up for permanent disability. It is not the right fit, but I recognise it is the only port available to so many parents, tens and tens of thousands of parents, and I think we should treat as a matter of urgency the need to provide them with a more suitable system of broad-based mainstream support. So yes, there's more work to do, but it is urgent work. It has drifted for the last couple of years, and we need to start to deliver it. To your question though about regional impacts, I think there are a couple of reasons why you see different numbers in different parts of Australia. As I said, some parts of Australia, like the Hunter or South Australia more broadly, were early launch sites or pilot sites for the NDIS in relation to children, so they're a little bit further down the road than some other parts of the country. I think that reinforces the need for action, because looking at where those parts of the country are up to gives you a sense of where the rest of the country is likely to head if we don't make serious change here. But like so many things in the health, aged care, veterans care, disability care sector, there are challenges getting workforce out into the region, and that's why, as much as possible, I think leveraging mainstream broad-based systems like primary care, infant and maternal health systems that states run, schools, early childhood education and care, is going to provide a much better system of access for parents, including in regional Australia.
Stephanie Dalzell from the ABC.
Hi Minister, thanks for your time. I also wanted to ask about the Thriving Kids program. Is this essentially a rebrand of foundational supports? And given you haven't been able to get the states on board so far, what makes you confident that you'll be able to get them on board with this?
Well, I wouldn't describe it as a rebranding. Foundational supports is a generic term I think you take from the Bonahady and Paul review to describe a system of supports that would be targeted at quite different cohorts. Children 0 to 9 is our first piece of work, but adults with quite severe and complex mental illness is another cohort identified in that review. So it's a generic term. I think it's appropriate that we refocus that principle into something that speaks to parents and speaks to the sector, and that's why we're using different terminology. We are focused on helping those kids thrive. That's what we should be focused on. As to where states are at, I've heard a couple of pieces of feedback from states. The first is that states felt that they shouldn't have to take full responsibility for leading this program, which is why I've indicated today we want to lead. We want to hold the pen on this with them. We think that it's far preferable to have a single nationally consistent program for thriving kids rather than 8 different programs developed at state and territory level. And that's certainly been the feedback, not just from states, but I've also got from the community more broadly. It doesn't make sense in 2025 not to have that single national consistency. Also, feedback I received from states was that they were concerned that we hadn't committed funding on an ongoing basis beyond the 5 years that were talked about at the National Cabinet meeting in 2023. Today I'll make that commitment to ongoing funding, not just for that fixed period of time.
Caitlin Rintoul from the West Australian.
Thank you for your address on the NDIS. As a journalist for the West Australian, I do have a very WA state-based question. WA Premier Roger Cook has slammed the federal government in recent days. He's had a series of damning reports into state hospitals. He's claiming that a lack of federal aged care funding is impacting WA hospitals through bed blockage. Why did the federal government reject WA Labor's request to match as a $100 million election promise for capital works on new residential aged care homes, especially given new modelling shown that there will be a gap of 2,800 beds by 2029 and up to 30 residential aged care homes will be needed to be constructed?
Well, we've done a range of things to relieve pressure on state hospitals, including in relation to aged care. We passed legislation through the Parliament at the end of the last year that frankly delivered once-in-a-generation aged care reform, and right at the heart of that was making this sector, the residential aged care sector, investable again. We'd been told by provider after provider and also by financiers and banks that the sector simply wasn't investable. So changes we made to retention payments in the sector, to lifting the maximum room rate, were all focused on doing what the providers told us were necessary to unleash the capital to build the beds that we need, particularly for that ageing generation of baby boomers who will start to hit the residential sector on average in the next 3 to 5 years. So, we have done what the sector was asking us to do. In the meantime, this year we've increased our funding to state hospital systems by 12%, the biggest increase in Commonwealth funding to hospitals you will find for many, many years. We're building urgent care clinics to take pressure off Western Australian and other state hospital systems. And only this morning, I think, we announced that expressions of interest for the next wave of urgent care clinics in your great state have opened today, and we hope that they'll be open by the end of the year at the earliest or early next year at the latest. So we're doing everything we can to assist hospitals in the pressure I know that they're all experiencing. And that includes, frankly, for the first time in many years, making the aged care sector investable so that those beds can be built. That's the contribution we've made to that pressure.
Minister, two things can be true. You can deliver record funding and the issues can still remain. The Premier is bringing a delegation to Canberra next week. Will you meet with him, and what will you say to him?
No, of course I'll be meeting with him.
What will you say to Roger Cook about these issues?
I'm not going to spoil Roger's surprise by previewing it with you with the greatest of respect.
Got a few in there. Sarah Ison from
Thank
Australia.
you. Thank you, Minister, for your time. A family court judge who presided over the 2013 re Devin case on allowing parents to prescribe their children puberty-blocking medication without court intervention recently said the outcome would have been different if this case were decided today because of all kinds of new evidence that's going to the lasting impacts of this medication. In light of this, along with the re Devin judgment this year that criticises some elements of the affirming care treatment guidelines, and of course the UK, Finland, Norway and Sweden restricting the access of these blockers, I wanted to ask your view on this today. Are you looking at any kinds of restrictions, particularly until something like the NHMRC review is complete?
Well, as you know, Sarah, we considered this as jurisdictions in different ways quite deeply over the course of the summer, and I announced in January, I think, that I'd asked the NHMRC to undertake a review of the clinical guidelines around what's described as gender-affirming care for children and teenagers. The NHMRC has a statutory charter to do that work. It's done it for decades. Its capacity to do that, I think, is unparalleled. Frankly, given the level of debate and contest around this, I thought it was appropriate that the most esteemed body in this area in the country do that work rather than have these debates play out in different ways in different jurisdictions. I've also asked the NHMRC to expedite some advice about the use of puberty blockers, obviously for teenagers, because that's the age that they take effect, or even a little bit earlier than adolescence, and that advice will be provided in the middle of next year. In the meantime, these services are all provided by state governments across the country. They are the ones who fund the services, employ the clinicians, make these decisions. Ultimately, Queensland has taken a decision about this that is different to some other states. That is their right, and they're accountable to their communities for those decisions. My job, as I see it, as the Federal Health Minister, is to ensure that those states and those services, but most importantly, parents and their children, have access to the most up-to-date, most expert clinical advice, and that is what they'll get from the NHMRC.
So to be clear, it's up to the states and you won't be intervening in this case until the middle of next year, at least, as you say.
I've done what I think is appropriate from the Commonwealth, which is to ask the NHMRC to ensure that states are acting on the best possible advice. I mean, the broad guidelines will take a little bit longer, but I recognise there's a little bit more urgency to get clear advice about the use of puberty blockers, which is why that will come in the middle of next year.
Thank you.
Megan Brodie from Med News.
Minister, I'd like to talk to you a little bit about evidence-based decision-making, which you've talked about with the NDIS, and turn your attention to a much older scheme, the PBS, where evidence-based decision-making has been done for 30 years. And the result of that, as you've said, is, of course, we drive a very hard bargain for medicines listed on the PBS. The proportion of our GDP going on innovative medicines for the PBS is 0.21% compared to 0.4% in Germany, 0.5% in Italy, and 0.78% in the US. But of course, that comes at a cost, and the cost is that we're now seeing only 1 in 4 new medicines launched in Australia, and on top of that, those medicines are not funded on the PBS for another 2 years after they land in Australia. And of course, we have the proportion of funding going to PBS is also innovative medicines means that has flatlined. The investment in innovative medicines has flatlined over the last 5 years. And we're also seeing the proportion of money that people are paying for non-PBS medicines has doubled. What the evidence suggests is that we are actually privatising the PBS by stealth. Is this your intention? And if not, what are you going to do to reverse that trend?
That's a very long question, Megan.
Lots of evidence in there.
That was a longer run-up than Malcolm Marshall used to have. You know, the PBS is deeply important to a Labor government. It's deeply important to Australia. It delivers Australia a terrific medicine system and has for close to 8 decades now, delivering Australians access to the best medicines available from around the world at affordable prices. As you know, prices that we want to make even more affordable. We have legislation in the Parliament now to reduce that co-payment to $25 from the 1st of January. But I do recognise that the PBS is under strain. That is why we continued with a commitment the previous government made to a once-in-a-generation review of our health technology assessment systems, that evidence gathering and assessment system you talk about, Megan. As you know, I've had an implementation group looking at that to provide me with more specific advice about how to sequence the implementation of that review. I actually had a look at their report over the course of the weekend, and I'll be publishing that in the very near future. I know that this system is under pressure, in part because we're lucky enough to be living in a turbocharged period of discovery where the number of new therapies coming onto the market, their complexity and frankly their cost in many cases is putting pressure on these sorts of assessment and reimbursement schemes. So I've said on a number of occasions, updating our cherished PBS is a priority for this term of government from my point of view as the Health Minister. It delivers extraordinary outcomes for Australian patients, which become more extraordinary over time. And if I can make a plug while the meeting up the hill is taking place, new medicines, innovative medicines, are a huge driver, perhaps the most important driver for productivity in the healthcare system. The Productivity Commission found that last year when they looked at a different way of assessing productivity in health, as you would know, Megan. Quality adjusted productivity, measured on the basis of quality adjusted life years, has been increasing in health by 3% per year, one of the highest rates of productivity improvement in any health system in the OECD. I think we rank 3rd, and the big driver of that is new medicines, particularly in cancer, where productivity has been growing more like 8 to 9%. So I do want to see the opportunity, the enormous opportunity of new medicines development become part of our productivity discussion, if I can make a plug to the discussion up the hill. And I recognise we do need to modernise our HTA system to ensure that for another 8 decades, Australians can enjoy one of the best medicine systems in the world, because that's what they've enjoyed over the past 8.
Just a quick one then off that interim report. Your own department has recommended that we set up an interim fund for implementing those reforms. Will you agree to put that in my EFO?
No, I'm not going to make any announcements about what we would do here, Megan. I don't think that will surprise you.
Next question, Sarah Basford-Canales from The Guardian.
Thank you, Minister, for the speech. You said the current growth rate for the NDIS of 8% by July next year is unsustainable in the medium and long term. With some of the original timelines proposed by the former minister following the NDIS review's release in late 2023, do you expect to be able to bring the growth rate to 4 or 5% by the end of the decade based on the work already underway and the announcement of the Thriving Kids program? Or are there other changes yet to be announced in the coming months and years?
So the first thing I'd say is that in addition to the 4 to 5%, I mentioned an inflator for ageing, which might be as high as 1%. So I think I talked about a 5 to 6% being probably the range, although much more detailed modelling would need to take place about that. Ultimately, this is a decision of National Cabinet. I'm stating a position on behalf of the Commonwealth about this, but states and Commonwealth are co-stewards of this scheme. States are more exposed to cost growth in the scheme now because they signed up to increasing their cap on growth spending in the NDIS from 4% to 8%. So this is a discussion that should happen at National Cabinet, but I do expect that we should start that process next year. Right now, we're focused on the current target, which is getting growth to 8% and the work that is underpinning that. But I think once that is achieved, we should not waste time in the next wave of reform. And that will be well beyond the work I've talked about in relation to kids. I talked about the things we should be doing in this scheme. We've got to introduce more discipline and integrity into this scheme. The sort of discipline and integrity you see in health, aged care and veterans care, those more mature schemes, pricing discipline, market stewardship, more providers registered and accountable for the services that they deliver to people with disability, more evidence to justify the sorts of supports that are being provided. This is the really hard but critically important reform work that will underpin that next wave of constraining growth. But I come back to the point I made earlier. This is all about people living with a disability. This scheme has transformed their lives, but we are at a fork in the road right now, I really sincerely believe, where we have to make sure that we shake up this system and get that sort of discipline and integrity into it that will deliver maximum value for people with a disability as well as for taxpayers and secure the long-term future of this scheme.
Do you foresee that additional reform being prompted by another NDIS review in the future?
No, I think, as I said in my speech, I think we will draw on the ideas that are there in that 2023 review from Bonner, Haiti and Paul. Also, bringing these portfolios together, I think gives our department, me as Minister, Jenny as Minister for the NDIS, much more capacity to compare and align systems in the NDIS with those other health and social care systems, particularly health and aged care, pricing systems, market stewardship, the sorts of evidence-based systems that give taxpayers confidence that the supports and services being delivered are actually going to make a difference for the people covered by the scheme.
So in terms of what really makes a difference, when you spoke about the instances of fraud, which are shocking, and non-registered providers, but is one of the big elements here when you talk about pricing discipline, what people or what registered suppliers are allowed to charge, whether it be for an OT or a psychologist or kilometres travelled. Some of it, if you experience the system, you're staggered at how high these numbers can be. Are you going to go through line by line and say, hang on, we're allowing people to charge too much for this service? This really isn't what people need to be able to have a thriving business?
I mean, I think we will look very seriously at independent pricing in this scheme of the type that we have had in hospitals now for over a decade and have more recently developed in aged care. Well, there is a very significant crossover in services delivered to people with disability under the NDIS and people in aged care, a very significant crossover. And I can't for the life of me see any reason why there should not be pricing alignment between those services. Often they're the same provider working in both schemes. We have workers moving between both schemes. And where there is not aligned pricing, you see distortion, you see leapfrogging, and you see a whole lot of perverse trends operate within a labour market that should be focused in a much more rational way on serving the needs of patients in health, recipients of aged care and participants in the NDIS.
Veronica Leonard from SBS.
Thank you for your address, Minister. You spoke about the changes, how these changes are not only an issue of budget, but also of social licence. How has the focus on NDIS blowouts affected those families who are relying on this scheme? Is there a risk of further alienating already vulnerable people who need this support by the way this conversation is unfolding?
I think there is a real risk to the sustainability of the scheme itself, because that is underpinned by social licence, by a sense that the broader community wants to continue putting the very substantial investment into the scheme itself. But it also, it is going to, ultimately, if we don't address this, start to rebound on participants themselves. They should be proud of what the disability community created through this scheme. It didn't drop out of the sky, as I said. It was the product of decades of determined, relentless advocacy by the disability community itself. I know how proud they are of the scheme that they largely built, obviously with government support and all the rest. And so that sense that there is a growing belief in the community that to go back to the research I talked about, it's got too large, it's out of control, there are too many dodgy providers in it. That's going to be of more concern to participants than anyone else in the community, I'm very confident about. And they, more than anyone, will expect a government, ministers like myself and Jenny, to do everything we can to get it back on track and to secure its long-term future. And that's what today's speech is all about.
Thank you.
Sabra Lane, welcome back to the Press Club from the ABC.
Thank you. Health Minister, thanks for your speech. Earlier you described the foundational supports as a generic term. I've just looked back at a press release that was put out on the 30th of January 2024 under different ministers, it's fair to point out, talking about the establishment of CAP-F, Foundational CAP-S Support Strategy, outlining that you'd got agreement at the National Cabinet in December to do this, and there had been an agreement on the funding split of 50-50, and also the Commonwealth investing $11.6 million. Is it fair to say that the foundational supports scheme, as originally put, is dead? This is the Investing in Kids Now scheme that you've outlined today is the new program that the Commonwealth will take control of. And I guess many people would wonder, well, what's happened to the $11.6 million that was set aside to do that?
Well, no, I wouldn't agree with that at all. What I'm doing is giving shape to what I think was a generic commitment to deal with a broad-based, quite diverse set of challenges in the scheme. I mean, what we end up doing in relation to kids under the age of 9 with mild to moderate levels of developmental delay and autism will be profoundly different to the way in which we provide supports for adults, often middle-aged adults, with severe chronic mental illness, often psychotic disorders. Well, those were the two cohorts identified under the generic umbrella term of foundational supports. Those are the two very specific pieces of work that all governments have. So I don't accept at all the idea that we've shifted away from the intent of the decision made by National Cabinet at the end of 2023. I do accept that that work has drifted. I do accept that today what I'm doing is indicating on the behalf of the Commonwealth our intention to lean more heavily into the design of that part of the program for kids, to support kids to thrive over the course of those ages.
So there'll be a thriving program and a foundational supports?
No, this is the encapsulation of foundational supports for that first cohort. National Cabinet decided that when we think about foundational supports, they wanted us to do work first of all on kids under the age of 9 and then come to that second big cohort of adults with psychosocial disability. So I don't accept it at all that we have shifted from the intent either of the Bonahady and Paul review or of the decision of National Cabinet. We're giving shape to it.
Rachel Jackson from AAP.
Thank you for your speech here today, Health Minister. The NDIS now has more than 700,000 participants, but that's still a fraction of the estimated 5.5 million people in Australia who live with disability. You've discussed reforms relating to children in depth today, but I'm asking, what would you say to an adult living with disability to help them understand why they might not meet the criteria, and to assure them that there are still avenues and a pathway forward?
Well, I mean, I think that the point you make, that there are significant numbers of Australians who have a level of disability out in the community, was always clear. When the review work that the Productivity Commission largely led, the campaign that led to the NDIS, when all of that was being developed, it was quite clear that we were building a scheme for people with significant and permanent disability to provide them with the reasonable and necessary supports that they need. And I think what we've seen for today's purposes, for kids under the age of 9 who might have a level of disability through developmental delay or autism, is that those alternative systems that were imagined at the time that would complement that NDIS, to the extent they existed, they were often defunded to find money for the NDIS. That's certainly the case in many instances for those adults with long-term psychosocial disability I talked about, who aren't in the NDIS right now. A lot of the programs we were building at the time, when I was Mental Health Minister, have largely been defunded, with that money being diverted back to the NDIS. So that really was the reasoning behind the recommendation that Bonahady and Paul made in their review. That's the reasoning behind the decision of National Cabinet. There will be different levels of disability that remain in broad numbers out in the community. The NDIS was for people with permanent significant disability. It was always understood broadly what that number would be, and we've pretty much stuck to that number, except, as I said, in one area, and that is kids with developmental delay and autism.
Next question, Kate Orbison from the SMH and The Age.
Thank you, Minister. The Australian Government has recognised and taken steps to address the systemic issue of medical misogyny in the healthcare system. I wanted to put to you 2 key measures that we're told would go a long way to make meaningful change for women in pain. One is, will you provide greater funding for longer GP consults? And will you mandate that all government-funded medical research embed sex and gender considerations at all stages of the research project when applicable?
Thanks, Kate, and congratulations for the award that you and your colleagues received earlier for the long piece of work you've done around medical misogyny. It's helped inform a lot of the work that we've done around women's health in particular, work that we announced before the election to provide women with more choice and more control and greater affordability for a range of supports that women need, often not because they're sick, but because they're women, around their reproductive health during periods of perimenopause and menopause and such like. But that doesn't finish the job of dealing with what I think people increasingly recognise is some entrenched, to use your term, your paper's term, medical misogyny.
We got that from a press release from the federal government, actually.
Usually works the other way. That's refreshing, thank you. I hope my staff are noting that. You've completely thrown me now. But you know, there is more to do. We recognise that, and I know the NHMRC, for one, is focused on reflecting on gender and sex in research. The case is well made that for many years, research tended to focus, in clinical trials sometimes tended to focus just on men because it was easier and cheaper just to focus on men as trial or research participants, with all of the consequences that your articles and others have pointed out. So we've got to do better than that. On longer consults, though, I will say that as part of the strengthening Medicare budget back in 2023, we did fund a Level E consult, so more than 60 minutes for GPs. We funded it at, I think, a very good rate. We didn't nickel and dime it. We made sure that it would be worth the while of the GP to do it, particularly at a bulk build level. And the uptake of that Level E consult for 60 minutes or more has been very strong. So I think we have made an impact there, and that was in response particularly to advice from largely female GPs who do a lot of that work with longer consults, particularly for women patients who didn't feel they were being compensated or reimbursed sufficiently for that. We're also doing that in areas like longer consults for perimenopause and menopause, for contraception and things like that. So I do think we are making inroads there, but we recognise there's more to do.
Thank you. You better incentivise shorter consults, though, when you made that funding announcement. And the NHMRC does say that it strongly encourages these sex and gender characteristics to be included in government-funded research. So why not just mandate it?
Well, I haven't got that advice from the NHMRC that that's something I should do. I'm happy to take that advice and consider it if it comes to me. I don't necessarily accept the argument that we've incentivised shorter consults. We've provided significant funding for those Level E consults, and with the bulk billing incentive on top of that, I think you'll find that we calibrated it so that you didn't get that drop-off in reimbursement that GPs were getting after the 45th or 46th minute that they'd seen a patient.
Thank you.
Final question, Corey McLeod, an MPC Director.
Thank you very much, Minister. Corey McLeod from innovationoz.com. At the end of March, the Medical Research Future Fund held $24 billion under management. Its 10-year strategy recommends an allocation of $650 million a year to be deployed, although in the last financial year it was only $408 million. Where is it going and why has it dropped off against the independent recommendations?
Well, I mean, you're right, $650 million is allocated out of the fund. It was allocated at that level even during that unusual period where returns of the fund were actually lower than that because of the low interest rate environment we face. So as government, we're committed to doing that. Then obviously it's a matter for the Health and Medical Research Office to get the funds out the door through the various missions that the MRFF has that are doing terrific work. So we just had a review conducted, a 10-year review conducted by the Treasurer and the Finance Minister of the MRFF, of that future fund. I think it's been a terrific contribution to the research effort. Ian Chubb, who's here today, and I sat down with a piece of paper well more than 10 years ago to write some terms of reference for Simon McKeon and others to look at with a review of health medical research back then, thinking that we needed a capitalised fund that would particularly underpin priority-driven research to complement the peer-initiated research or the investigator-initiated research of the NHMRC. It's added hundreds of millions of dollars since we did that work, hundreds of millions of dollars every year to research. We'll have a look, having done that 10-year review, about whether there are ways in which we can ensure that money's getting out the door as quickly as we can.
To its original amount. Thank you very much.
Very quick one to end on. A growing number of experts talk about screen time possibly being responsible for developmental delay. The old adage of prevention better than the cure. Is that something you're looking at all?
Well, I'm reluctant to sort of get into a space that really experts are still a little bit unsure about. There's a pretty vigorous debate about what screen time, what social media means for various aspects of a young child's development. And we're erring on the side of caution as a government, though. I mean, I think the fact that all state governments now and school systems have pulled phones out of schools, something that still many other jurisdictions of the world are grappling with, has made a huge difference already. School principals and teachers say that overnight it has changed learning behaviour, playground behaviour, interaction between students, getting back to what was the norm when certainly I, and even you, Tom, was much younger than me, were at school. So we're erring on the side of caution there. We're obviously, in a world-leading way, introducing minimum age arrangements for access to social media. I think there is a growing body of evidence to suggest that access to social media at young ages is driving the rising levels of mental distress we see among young people, not just here in Australia, but in other countries of the world, particularly, frankly, English-speaking countries. So, there is still more evidence and research for experts to do here about exactly what this very significant, relatively new phenomenon is doing to the health and development of our young kids. But we're adopting the precautionary principle, I think, as a government, and trying to do everything we can to free kids from those devices as much as possible.
My first phone was year 12. It had Snake in black and white. It wasn't that addictive compared to smartphones, I think. Ladies and gentlemen, please thank our Auslan interpreters and the Minister, Mark Butler.